The Competition Commission has reached an agreement with private labs to reduce the price of the COVID-19 PCR test. This was after prices had already been reduced to 850 rand. That was from 1,000 rand at the start of the pandemic. The Commission says further price cuts could be in the pipeline as they continue to monitor input costs of suppliers and laboratories. The new price, it's in place with immediate effect and has been set at no more than 500 rand. So Kgabo Komape is the chairperson of the Independent Community Pharmacy Association. He joins us now to unpack what the impact of this new pricing model will have on consumers. Kgabo, it's great to talk to you on what is an incredibly important story. And I want to ask you this. We talked about it a bit offline. But, you know, it'll be interesting to know what the cost price for these labs is for a PCR test. So how much profit would they have been making from 1,000 rand at the start of the pandemic to 850 rand before the price was reduced?
Thank you very much, Michelle, for that question. Indeed, it's a welcome breakthrough for the public in terms of the cost there, because if you look at the original price where the consumers were paying about 1,000 to get a test, it is actually prohibitive because we're already dealing with the problems of access. You would note that those that are not covered with medical aids, for example, will need to be paid cash. And if it's 1,000, obviously it means you'll be testing less and less people instead of more, which is the better response for the pandemic. But I think the cost, let's put it this way, Michelle, and say, obviously the initial cost of the input costs for setting up to be ready for issues of pandemic and testing for COVID-19 may have taken a bit of a toll on the labs, and it is justifiable for them to recover a little bit in the beginning stages. However, as we proceed throughout the pandemic and we're testing more and more, obviously the input cost starts to reduce. I think that is where the labs should have actually taken heed and lowered the prices without having to wait for the commission or any kind of investigation. So here we are dealing with the issue of economic balancing the economic issues of the lab and balancing also the ethical and moral issues of the public rights to get tests, and so that the state can respond better to this pandemic.
Yeah. So
indeed, we welcome the intervention at this point.
Yeah, absolutely. And of course, the worry with the 850 rand test, Kgabo, as you said, is prohibitive. It means that people would have chosen not to test, probably.
Probably, Michelle, we may hypothesize and say if the cost is expensive, there are ramifications to that. Obviously, number one, you are going to be dealing with the lack of motivation for members of the public to test, obviously because of affordability, which makes sense to everyone. And you may also look at it from the funders' perspective, which are the medical aid, for example, that are paying for their members. They also may not want to pay more in terms of ensuring repetitive tests, which may be necessary, particularly when we deal about the healthcare workers that are covered by the schemes. Now, you also look and say that the ripple effect of that prohibitive cost is that when members of the public don't test, it means the statistics that we are now having, as for example, from the NICD or from the National Department of Health, you'll be dealing with statistics that are skewed because of the lack of sufficient testing. Now, it would have been good if this tests were affordable, because then our statistics will reflect exactly what is happening in the country. And I believe that that would have skewed the stats because of the people that are not testing, obviously for the reasons that we are citing now.
Yeah, absolutely. Can I ask you this question? Because there's been a lot of discussion around the PCR test versus the rapid antigen test, Kgabo.
Yes.
The advice that we've been given from professionals at testing stations was that the rapid test really is for someone who has symptoms, plain to see symptoms of COVID-19. What is the role then of the rapid test? It comes at a cheaper price, so people would have perhaps chosen the rapid test over the PCR test if they needed to test for COVID-19. But what's the efficacy of the two compared to each other?
Thank you very much, Michelle, for that question. And I'm happy that you are citing the efficacy. If you look at the rapid test, the work of the rapid test, the primary role of the rapid test is just to ensure that those that are presenting with symptoms can be confirmed the earliest and at a lesser cost. But actually the preferred test has always been the PCR because obviously of its accuracy. So with the rapid test, you are looking at less than 60% of accuracy, and whereas with the PCR, you are looking between 90 and 95% of the accuracy. So now the cost is good on the rapid, but the accuracy and the reliability cannot actually be relied upon except only as a screening. If you are just screening, it's okay for the rapid test, but if you are to ascertain that test, you then need the PCR test, and that is the one that is admissible even when you are maybe visiting other countries. It is not the rapid test that they will allow you to cross the border, for example. You will need the PCR, which is the one that is more expensive. So yes, that one is just for screening.
It's really a screening tool. Of course, if you're traveling outside of your own borders, the PCR test is the gold standard when testing for COVID-19. Does the rapid test price, in light of this reduction in the PCR price that we've seen now, from 850 to 500 Rand, does the rapid test price remain the same?
It wouldn't remain the same, Michelle. In terms of economics, we all know that the influence of the gold standard will always impact on the silver standards and other standards or other lower tests, for example, in the supply chain or in the testing chain. Now, we are expecting that the rapid test will also have to respond accordingly, even though the competition didn't reach to that level of investigation. But I believe the knock-on effect is that the rapid test will also be lowered, which means we can expect to see the rapid test also taking a little bit of a price knock in terms of how normally things occur when you are lowering the price of the other superior item, for example, in this case, the PCR test.
So it's Ampath and Lancet. That's according to my understanding, Kgabo. Ampath and Lancet have reduced the price of the PCR test effective immediately to 500 Rand. What about Pathcare?
Obviously, the complaint that was lodged by the CMS may have not specified, or it may have specified exactly the labs that they are looking at. And once the Commission has established this standard, it is applicable to all the labs, including those that were not investigated.
Right.
The findings is implementable immediately, and it affects all the labs that are doing the PCR tests. So we do not worry about any other labs. They will have to follow suit. Okay,
that's good to know. And of course, the fine print in this decision from the Competition Commission is that, yes, it's a victory getting the price lowered from 850 to 500, but there is still room to maneuver on that price. It may still be lowered even further.
You are absolutely correct there, Michelle. And the submission is that when you see the agreement between the Competition Commission and the two labs, one may say it's a compromise. You know, when you are in a negotiation and you are trying to find the common ground, and the labs are showing what they believe that they for the right to charge, and the Commission is obviously on behalf of the public looking to say, but your costs are not justifiable as the charge and allegation from the CMS. I think the normal route is that when it's like this, obviously, we're anticipating a situation where the labs can't deny that they've already recovered their input costs, and it would have been natural for us to expect a lowering of price. But I believe from henceforth, this is the step in the right direction. I believe that it's 500 now, but with further testing and obviously economics of scale, where more people, I believe, will start testing now because it's getting more affordable, and obviously the traveling families and the likes will increase the flow of testing because it has become a little bit more affordable. I think that will pave the way for a further shave of the price to make sure that it goes as low as possible. Who knows, maybe we may end up at 350 or so.
Yeah. So while I have you on the line, Kgabo, let me get your advice on when is the best time to test for COVID-19. If I've come into close contact with someone who has tested positive, how long do I wait before taking the PCR test?
The earlier the better, Michelle. Obviously, because of the affordability of the test, people will want to wait and see symptoms first. But the ideal situation, if cost was not a problem, you needed to test as soon as you discovered that you were with Michelle, and Michelle has been proven to be positive. Now, there is no window for you to be waiting because the PCR test is sensitive enough to pick up if you've managed to get any RNA or so from the close contact that you were with. So the rule of thumb is the earlier the better.
So there's no 3 to 5 day waiting period?
The 3 to 5 waiting period is just to allow people actually to see if there could be any symptoms, because symptoms will develop in 3 to 5 days if indeed there was an infection. However, it is ideal that we do not wait for symptoms and test immediately. There will be feedback. The PCR test is sensitive enough to pick it up even before that period. However, it has been put, obviously, to try and not have a cost burden of testing multiple people or multitudes of people when they could have waited 3 to 5 days to see if there are any symptoms to worry about. But the ideal situation in preventative health is that you test as soon as possible, which is the earlier the better.
Chairperson of the Independent Community Pharmacy Association, Kgabo Komape, thanks very much indeed for your time this morning.